and welcome back to the show. Well, as we start off, in New York, African Americans account for about 37% of those living with HIV, despite only accounting for about 14% of the total population. As we recognize the work that's being done for Black Americans, Governor Hochul is persisting with a move that's actually exacerbating health inequities and making it harder to end the epidemic in New York's Black community. This is according to some people. And joining us now is the Senior Director of Public Policy and Advocacy for Callen-Lorde Community Health Center. And we've got Kimberleigh Joy Smith. And thank you so much for being with us.
Thank you for having me.
So thank you. And, having this conversation is very important. We talk about those statistics and somebody may say, well, that's not too bad. But the reality is those numbers are quite telling.
They are. I mean, we're seeing a lot of progress with HIV and in terms of ending the HIV epidemic here in New York and across the country, really. In 2019, actually, here in New York, we were able to bend the curve. And what that means is that we were able to see a decrease in HIV prevalence for the first time. And so we celebrate that. However, what we're also seeing more recently is, first of all, the COVID-19 pandemic really did sort of suppress uptake of PrEP, which is pre-exposure prophylaxis. It suppressed HIV testing, and it really sort of curtailed people being engaged in care. So this is concerning. And what we're seeing from the latest data is that even though overall we're seeing progress with HIV, there are still some very persistent and vexing disparities that exist among people living with HIV, and particularly that are impacting Black people who are living with HIV, transgender folks, and young men who have sex with men. And in fact, in that most recent data, what we're seeing is that the rate of new HIV infections among non-Hispanic Blacks is 7.4 times higher than the rate among non-Hispanic whites. So clearly, despite overall progress that's being made in terms of ending the HIV epidemic, we still have a lot of work to do.
Let's talk about New York State for a minute. Governor Hochul has really come out and she's talked about some initiatives and some things. Talk to me about how you view the governor's approach and what's happening with regards to HIV and AIDS.
Well, the governor has supported our campaign to end the HIV epidemic, and she has put her money where her mouth is and dedicated resources to ending the epidemic, and for that we are very grateful. However, she is also persisting with what we think is an ill-advised plan that will disrupt or threaten our efforts to end the epidemic. What she's proposing is to move the Medicaid pharmacy benefit from managed care to fee-for-service. And this may not seem like a big deal or kind of wonky, but what that is doing is, what that's going to do actually is disrupt access to a federal stream of funding called 340B. 340B is the actual federal drug discount program. And by making this policy change, she's disrupting community-based healthcare clinics like Callen-Lorde and many across the state. She's sort of stopping our ability to get that revenue savings. And what we've been able to do in New York, is sort of really build a robust healthcare safety net. And that, I think, is why we can say we've made so much progress in ending the epidemic to date. And that, this safety net is community-based healthcare clinics like Callen-Lorde, but it's also Ryan White care programs and other community-based organizations and social service organizations. And we've been able to invest resources in these programs and in the safety net to support, advancing an end to HIV and advancing health equity and health justice. But this policy change is going to siphon away millions upon millions of dollars from the community-based healthcare safety net, and then, threaten this progress that we've made.
If we're talking government for a moment, obviously the governor has her plans, and then she rolls them out, and then guess what? You get a lot of local elected officials, community-based organizations, people such as yourself who are actually raising their voices saying, hey, appreciate the effort, but this really is doing some damage. What's been the feedback in your community against the governor's proposal, and what support have you gotten from other maybe local electeds who are trying to feel the plight of this too?
Yeah, I mean, we've got a lot of great feedback. We are working very hard. Callen-Lorde is a part of a larger network and coalition called Save New York Safety Net. And this is a statewide coalition of safety net providers, community-based healthcare clinics, like I spoke about, the Ryan White Care programs, and even some HIV special needs plans. And so we as a network are pushing very hard for the governor and the legislature to not put this policy in place. The policy, if it goes forward, is set to go forward on April 1st. And so we're really asking the legislature at this point and the governor to stop and to take under consideration an alternative that we have come up with. And this alternative would leave that 340B mechanism in place. It preserves net. We actually think it will save the state money, and it will avert all this disruption that we fear is going to happen for our patients and communities across the state. So the feedback has been good, but we still have a lot of work to do. We're actually asking assembly members in particular across New York State to really stand up in conference next week and support the Carve Out compromise that our coalition has put together. So we have heard, we've had some initial support from the Assembly Health Chair, Amy Paulin, and the Senate Health Chair, Gustavo Rivera. They are vetting our compromise, but they really need to hear from their members that they are in support of this compromise legislation. So that's kind of where we are now. We're still sort of building support and hoping that we can stop the carve out from happening and keep up the progress to end the HIV epidemic and continue to support people living with HIV as well as prevent HIV from happening.
Can you give me your assessment post-COVID? I mean, we want to say post-COVID because we're still dealing with it, right? But
Right.
in the heyday of COVID, we understood that a lot of communities were overlooked. Those, particularly the HIV and AIDS community, had a lot to contend with during the COVID crisis. Talk to us now about where we are. Also, being destigmatized, right? So many people were up in arms, or not even up in arms, but had so many misnomers when it came to HIV and AIDS. But talk to us about the destigmatization of, and what do you feel where do we feel, I should say, we are right about now?
Yeah, stigma is still very much an issue for our people living with HIV and impacted by HIV, and certainly for our Black and Brown communities. And it's something, unfortunately, that didn't, get eradicated with the COVID-19 pandemic. I mean, I said earlier that the COVID-19 pandemic really kind of exacerbated barriers to HIV prevention and care, and it really did sort of suppress folks from being able to go seek preventive treatments, from going to get HIV testing, and then ultimately prevented them or suppressed sort of their connection to care. And this is not, obviously not good. And we actually saw a little bit of an uptick in terms of new HIV diagnosis here in New York City. And so that, we're still sort of working our way out of that. But stigma also remains, a big issue for our communities. We want folks to, get affirming health care, to take care of their sexual health. And sometimes, that can be difficult in communities that you might fear discrimination, you fear stigma for various reasons. And so it's something that we are still confronting, and have been confronting throughout the pandemic and now moving forward.
Lost mute right there for a second, but I want to take a moment and just have you share a little bit about testing, right? Because I think that's still important. And I know a lot of people sometimes have an aversion to it. From your expertise? Are we seeing more and more people engaging in testing and taking advantage of the resources that are out there?
I mean, I think overall, more and more folks are. Again, the pandemic did kind of put a damper on that a bit, but I think we're getting the word out in the community that testing is very important, and it's part of something that you should do to take care of yourself and your health. We sort of policy-wise have been inching toward making testing something that's routine for folks. And so that when you go to the doctor, that's just a part of your routine medical care. And so, I think, again, we're making progress, but there's still a lot of work to do. And unfortunately, the progress that we are seeing with ending the epidemic has not been sort of equally felt across all communities. And that's where we really need to kind of double down and focus our efforts on to make sure that we can end HIV for all and not just sort of one group or a couple of groups.
We're coming off the opportunity for awareness, and during every year, HIV, about AIDS, about stigmas, about things that people need to know. What are you hearing from people as you continue to go out and share your message?
Well, I think people, there's a little bit of complacency, and this is not entirely new. And then, COVID-19, that pandemic hit, and I think that probably didn't help matters. So HIV is maybe not as in the forefront of everyone's minds as it might have been in prior years. However, then, whenever you turn on your TV, you might see an ad for a pre-exposure prophylaxis medication, and you see affirming outreach to folks, encouraging them to take care of themselves and investigate different prevention options and treatment options. And so that is a good thing. But I think what we need to do is kind of continue to try to accelerate the ending the epidemic efforts, continue to invest resources, and really push our elected officials to, create policies and support policies that invest in our healthcare safety net, like the, like investing in the community-based healthcare centers like Callen-Lorde and others, and not doing policies like the Medicaid pharmacy benefit carve out. Those policies take away from the healthcare safety net and disrupt the healthcare safety net, and will be devastating to many, many thousands, maybe millions of patients across New York State.
Talk about the governor's plan. Talk to me about where it is right now, and where will it be going over the course of the next month or so?
Great question. Well, where it is right now is that the plan is set to take effect April 1st of 2023. That's just a few weeks away. The governor did indicate in her budget briefing book that she plans to move the Medicaid pharmacy benefit from managed care to fee-for-service and siphon away this money. They have indicated, the state has indicated that they have a plan to reinvest a pool of money that they think will make up for the money community-based healthcare clinics like Callen-Lorde will lose. We believe that plan is not sufficient. And furthermore, we don't have a lot of details about how we will see that revenue. And April 1st is right around the corner. We have a lot of concerns that the mechanism is not going to be in place, and that patients' care is going to be very seriously disrupted. So that's where the plan is. It's a sort of vague plan, I guess, that's not even written in the statutory language of the budget. But we're hearing information from the state that they have this reinvestment plan that we think is very seriously not sufficient. And we're hoping that they will really take under consideration our compromise proposal, which, as I mentioned, will not disrupt the safety net and keep folks in the care that they deserve.
Knowing the potential ramifications, how can the public actually play a part in raising their voice and supporting this effort?
That's an excellent question. I would suggest at this point that the public, if you know or can figure out who your state assembly person is, or state senator for that matter as well, to call upon them and ask them to support 340B and to support the compromise bill as opposed to the Medicaid pharmacy benefit carve out.
And right now, we know that we're just starting 2023, and we're still in the initial months. But can you give us a little bit of a forecast as to the work that you'll be doing throughout the course of this next year?
Well, we're going to continue serving people and providing affirming quality healthcare. The clinic that I work for is a federally qualified healthcare center. We serve LGBTQ communities, but are open to all regardless of ability to pay. So we're going to continue to provide all the sort of competent healthcare that we can, and all of those sort of wraparound services that help folks get engaged in care and stay in care. We'll continue to provide quality sexual health programming, HIV testing, and just really doing all that we can to make sure we meet the needs of our communities.
Well, Kimberleigh, it's been a joy having you, and thank you for the work that you're doing. Thank you for giving us some clarity as to a little bit about 340 and what this really means. I think it's important that the public knows what's coming down the pike potentially, and also what they can do in order to raise their voice. So thank you for being a great voice and a great advocate, and being with us here on the Social Justice Forum.
All right, appreciate the time. Thank you.
All righty. Well, we want to thank Kimberleigh Joy Smith for being with us. And guess what? We're taking a quick break. We'll be back more here on the Social Justice Forum.